All right, summer's here. You're probably thinking about barbecues, maybe some pool time. Oh, hopefully a vacation.
Definitely this season to recharge.
Yeah, exactly. Taking a break is great. But here's something to think about. While you're taking time off work, should your health also be on that, vacation list? Probably not.
That's a really good point.
So today we're doing a deep dive into some guidings from TRICARE Communications. They've got some really practical tips on summer health and wellness using your benefits.
Mm-hmm.
Our mission here is pretty straightforward. Unpack 4 key ways you can leverage your TRICARE benefits this summer. We want to give you that shortcut, those useful nuggets of info.
And it taps into something important.
Yeah.
Janine Pickrell mentioned she's the Director for Population Health at TRICARE Health Plan.
Oh, right. What did she say?
She said, now can be a great time for you and your family to catch up on preventive health care and take care of other health needs. It's about being proactive, not just reactive.
I like that. Get ahead of things. And honestly, some of the covered services might surprise you. Understanding them now could, save you money and maybe head off bigger problems later.
Absolutely. So where should we start? Preventive care seems like the logical first step.
Okay, yeah. Let's unpack that. We hear preventive care a lot, but what does it actually mean in the TRICARE context? Why is it so vital, especially now?
Well, think of it as your health's early warning system.
Yeah.
It's designed really to catch potential issues before you even have symptoms.
Okay.
So TRICARE-wise, that means things like cancer screenings, making sure immunizations are up to date, and those health promotion and disease prevention exams, they call them HP and DP exams.
HP and DP exams.
Yeah.
Got it. And it's not just a blanket approach for everyone, is it?
No, definitely not. It's tailored. Which services are right for you depends on your age, your sex, family history, other risk factors. It's personalized.
Makes sense. And what about the cost? Because sometimes, cost can make people hesitate, even for checkups.
That's a huge plus with TRICARE. For covered preventive services, if you see a TRICARE network provider, there are actually no out-of-pocket costs.
No out of pocket.
Yeah, it really removes that barrier. The TRICARE costs and fees sheet has all the nitty-gritty details if you want to look them up.
Okay.
Just a quick heads up for active duty service members, though.
Yeah.
You usually need pre-authorization if you want to see a civilian provider for preventive care.
Good to know. And for others?
For most people on TRICARE Prime and TRICARE Select, they cover one of those HP and DP exams every year. That's your big annual preventive checkup.
That no-cost feature is, it's a strong nudge to stay on top of things, so the advice is pretty clear then.
Yeah, talk to your PCM, your primary care manager, or your regular provider. Or you can just go online and check TRICARE's list of covered preventive services yourself. See what applies to you.
Right. Okay, moving on from individual care. Let's talk families. Because summer means one big thing for parents, right? Getting kids ready for back to school.
Oh, absolutely. Summer's actually a great, less hectic time to handle all those school health requirements.
So what's the deal with school checkups and TRICARE?
Well, good news first. TRICARE does cover the physicals that are required for school enrollment. Most schools need an annual health exam, and they definitely want vaccination records up to date.
Okay, that's helpful, but I imagine school rules aren't the same everywhere.
Exactly. The source material really stresses this. Check with your child's specific school about their health policy. Requirements can vary quite a bit.
And that might mean more than one appointment.
It could, yeah. Depending on what the school needs, forms filled out, specific tests, vaccine schedules, you might need a couple of visits. So the big advice is, don't wait until August.
Yeah. Avoid that last-minute scramble. Okay, here's a common one. Sports physicals. Are those covered too? My kid needs one for soccer.
That's a really important distinction they make. TRICARE doesn't cover annual sports physicals. Yeah, those are considered separate from the general school enrollment physical. So the checkup to get into school is covered, but the specific one needed to play sports, unfortunately, isn't.
Okay, that's a crucial detail. Good to know. But even if a physical isn't strictly required by the school, kids can still get checkups.
Oh, for sure. Kids can still get their regular preventive checkups. Remember those annual HP and DP exams? Those are for ages 6 and up.
Right.
And for the little ones, TRICARE covers well child exams from birth all the way through age 5. So there's coverage across the board for keeping kids healthy.
Fantastic. So options are definitely there. Okay, let's shift focus again, something maybe we don't think about as much during summer fun. Our eyes, vision care. How does TRICARE fit in there?
Yeah, eye health is easy to overlook, but so important. Routine eye exams aren't just about, checking if you need new glasses.
Right, it's more than the prescription.
Much more. They're designed to monitor your overall eye health and, crucially, catch eye diseases early. Things like glaucoma or diabetic retinopathy. Early detection is key.
So, does my regular TRICARE plan cover a routine eye exam? Is it that simple?
It might. This is where it gets a little, dependent on your situation.
Okay.
Your specific vision coverage depends on who you are, like active duty, family member, retiree, your specific TRICARE plan, and sometimes your age.
So, you really need to check the specifics for your category.
Exactly. The source actually points to different pages on the TRICARE site for each group.
Yeah.
Active duty, their families, Guard and Reserve members and families, retirees, and their families. It's all spelled out there.
Got it. So, check the website based on who you are. But what if you need, glasses or contacts? Does TRICARE cover that, or is there something else?
That's usually where the Federal Employees Dental and Vision Insurance Program, FEVIP, comes in.
FEVIP. Okay.
If you need coverage for glasses or contacts, you might be eligible for a FEVIP vision plan. You can enroll during the federal benefits open season in the fall. Or if you have a FEVIP qualifying life event or QLE, things like getting married, having a baby, that kind of thing.
And are those the same QLEs as TRICARE QS?
No, and that's a really important point they make. FEVIP QLEs are different from TRICARE QLEs. Don't mix them up.
Okay, good heads up. So where do people find out more about FEVIP?
Benefits.gov. That's the official site, benefeds.gov. You can check eligibility, compare plans, all that stuff there.
Perfect. Okay, we've covered physicals, school checks, eyes. Let's move to our final area, and it's a really critical one, mental well-being.
Absolutely critical, and maybe something folks push aside when life gets busy, like in the summer.
So what's the key message from TRICARE about mental health?
The biggest message is you don't have to be in a crisis to seek help. Early intervention makes a huge difference.
So recognizing the early signs is important.
Definitely. The source lists some things to be aware of, signs that might indicate a problem is developing.
Like what?
Things like changes in eating or sleeping too much or too little, pulling away from people or activities you usually enjoy, feeling really low on energy or having trouble concentrating. Also, feeling kind of numb, like nothing matters. Or maybe unexplained aches and pains that keep popping up. Feeling hopeless, helpless. Even noticing you're smoking or drinking more than usual.
That's quite a list. Things we might brush off individually, but together they paint a picture.
Exactly. And the good news is TRICARE covers a really broad range of mental health services.
For short-term issues or longer-term stuff too?
Both. Whether you need support for a specific short-term stressor or more ongoing care, the coverage is there.
And how do you get started? What's the first step?
There are basically three main ways. First, you can always talk to your PCM, your primary care manager. Depending on your plan, you might need a referral or pre-authorization for some types of care, but they're a good starting point.
Okay, option 1, PCM. What else?
Second, you can often reach out directly to a TRICARE authorized mental health provider. You don't always need a referral first.
Oh, that's good. More direct access.
Yeah. And third, there are virtual health options. You can talk to a provider online from home. That really lowers the barrier for a lot of people.
Virtual care is definitely a game changer. So multiple ways to get support. And if people want all the details.
The TRICARE website again, they suggest going to the covered services section. You can search by keyword or category, or just learn more generally about how TRICARE covers different kinds of care.
Great. So recapping our deep dive today, we looked at 4 key areas to leverage your TRICARE benefits this summer. First, getting smart with preventive care.
Right, those no-cost checkups.
Second, tackling those back-to-school health requirements early.
Avoiding the August rush. And remembering the sports physical difference.
Third, prioritizing your eyesight, understanding the nuances of coverage, and checking out FDVIP if needed.
Yep, keeping those eyes healthy.
And finally, and maybe most importantly, nurturing your mental well-being, knowing the signs and the pathways to care.
Recognizing that seeking help early is strength.
Exactly. This whole deep dive was really about giving you, the listener, a bit of a shortcut practical info to feel more informed and hopefully empowered to use your benefits effectively.
Which kind of leaves us with a final thought, doesn't it? In this world where we're just flooded with information, how much could consistently taking these small proactive steps with your health benefits actually transform your overall well-being? Not just for this summer, but year-round, making it a real foundation.